My name is Dr. Anila Khan, clinical psychologist, psychotherapist, speech and language therapist, and today I am privileged to give my or present my work to EUCAP, organization that is the biggest and largest organization in the Europe. And I'm happy that I got this opportunity to present my work, uh, the Asian work that I do, the international that I'm doing with the community. And today I would like to tell you something about the work that I do, and I would also like to mention that what differences and what I learned from working from with different communities. So I'm happy to present my work to European Council of Autistic People. I'm sure I'm not pronouncing it wrong. Yes. So my basically I am approached to present my work as Global Alliance for working with work, Global Alliance for persons with different special and additional needs, and I'm working in Pakistan and international also. And I would also like to tell that I'm also a autistic person, and I was in start. I was, maybe you could say that I was diagnosed maybe as ADHD, but things did not make sense to me when I was working, because I'm working with autistic community since 2011. So with later on, I get this idea that what is happening around with me, and the major part was talking to a lot of autistic communities and a lot of doing research on that. So basically, I'm a clinical psychologist, speech and language therapist. I'm a psychotherapist. I'm a trainer. I'm a speaker, a public speaker. I do public speaking. I'm doing mental health advocacy, and I'm doing work. I'm also working for autism advocacy, and I already told you that I'm a neurodivergent therapist. I'm a social worker and human rights. I was working before as a human rights defender, but later on I started understanding that I am more required to work for disability rights. So my interest shifted from human rights to disability rights, and I also work for my, because I started my work as with children, and later on I developed my more skills. So I work for children rights, and I work in Pakistan, working in international communities. So these are some organizations that I'm working with and some projects that I'm involved with. The first is that is Sound of Autism in Arizona, and that is a non-profit organization, and I'm global international director for Sound of Autism. And we are international, and we are not just in America and US, but we are in the country also. And over there we have different works, and I will just show you my work in the other my other slides. The other thing that I'm working with is a Global Alliance for person with different additional and special needs. I'm basically a founder, and over there I am conducting different seminars, webinar, workshops. I'm creating content, and I'm also reaching out other areas. I'm also reaching out third world countries, and I'm working with different communities in different regions to understand, give them understanding of not just mental health, but the understanding of neurodiversity and especially autism. Because still, what I think is autism is a new phenomena in terms of getting the real understanding of autism or autistic individuals. And there are a lot of things that we need to consider, because there are few traits that are rewarded by the different cultures. So if I get a chance, and with passage of time, I would share different understanding that I get with working with those culture. Now I just started working with recovering from childhood trauma, and over there I am talking about the aspect of trauma that a child is getting, being a neurodivergent kid or a family who have a child who is neurodivergent, especially autistic or ADHD. And over here my concern is, or the thing that I'm talking about is neglect, abuse, domestic violence, and also um trauma and recovering from those things. I'm also talking about different aspect of abuse, and I'm also covering the aspect of child sexual abuse over there, because there are a lot of children who are non-verbal, or if they are even verbal, they cannot communicate because of so many problems in communication. So I am talking about those aspects. Then I am working with refugees at risk community. At risk community means that a third world country. I'm reaching them out, and I'm working with them, and sometimes they reach me out to give them understanding, give them trainings. It could be a hospital, it could be a community, it could be a group, to work with them to develop mental health community over there. And also, when I'm working, then I'm also talking about neurodiversity and autism. Then I'm also working for Imam Connect, that is in UK. Basically, that is a Muslim World Alliance, and it is more than in 56 countries. I'm working with them, and over there, I'm working on same aspect, but over there, that is a specific thing in terms of community. So I'm reaching a lot of regions and countries through my work. Now, I'm also nominated for awards, Autism Hero Award, and all the nominations are for 2023 International Special Women Award, then 23 to 2023 Mental Health America Conference Award and National Diversity Award 2023. Now, now a lot of people will ask this question, or this coming in the people mind, that how I am working, or what are the ways that I am reaching, because humanly it's not possible for me to go to every place. So what platforms that I use are mostly social media. So these are Twitter Spaces and Instagram Live, Facebook Live. It could be I make a video that I upload on Facebook. Then I'm also doing those same things on LinkedIn too, which I didn't mention over here, but I am posting my stuff over there too. Doing virtual workshops, we're doing virtual webinars, doing virtual you could say discussions and trainings and podcast. And I have different podcasts. One is Spectrum Toxin Tips, where I'm talking to a lot of parents, especially focus over there is autistic communities, autistic children. And sometimes also talking to autistic adults, also talking about their journey, how they came to understand that, and how they were diagnosed, and how they took that understanding, and how they are changing their life after they are diagnosed, or how it transformed them. So it is a kind of a disclaimer, because I showed some picture over here and I recorded some of videos those, but they know that I am doing that, because when I'm posting some videos, people ask me that, do they know that you are taking a picture of things like that. But the point is, yes, they know that I am recording that, because whenever you are having a Zoom meeting, you get the icon that is recorded. So support group that I don't record, which I just recently started. Other videos are recorded, and I took concept of them already. So this is basically, you could say, these are training workshops which I'm doing with parents, professionals, families, organizations. And this one was about, if I talk about this one presentation, that was about sensory differences. And sensory differences, from that I mean hypersensitivity and hypersensitivity in ADHD or autistic or neurodivergent children. So it was for parents to have that understanding and have the idea that what they can do with their children at home and school setting also. So I'm doing support groups and support group in regional language, which I do, that is a Persian Urdu also. And I'm also doing support group international, that is in English language. And over here I would like to mention that this is one of our support group that at that time we celebrated mental health day, and our theme was autism and family who have autistic children, or who are working, or organization that who are working with autistic community. So that is a recording, or you could say the slide share of that. Now that is a support group that I recently started, and it is like more than, you could say, week, sorry, not week, sorry, month. It's more than a month now, and I'm working with Lara in that group. Her name is Lara Sheffield, and we name it as a Bridges Global Community Group for Autistic Adults. And over there, we are connecting our autistic adult worldwide, and we are just somehow trying to cross the barrier of language, but to develop some kind of software so it is accessible to everyone. But that is basically a global community for autistic adult, and anyone can come to that. And that is every Sunday. Timing is 12 noon ETD time, Eastern time, I guess it is Eastern, and 6 p.m. CET time. And um, this is a beautiful community that we are building on different spaces on regular basis. So this is my podcast that I'm doing, and the main theme over there is autistic children, adult, or parents. But I'm talking to other professionals also, or somehow those professionals who are working with autism, who are working with SEND community. And the name of Spectrum Toxin Tips International. And before that, I also did Let's Talk with Dr Anila Khan. And over there, you could say that if I just calculated the discussion that I have done, or it in the form of you could say professional or regions that I contacted, is more than 50. You could call it regions, communities. So it's more than 50 communities or regions or areas that I talk to people. And theme was around mental health and autism and services that we're providing. So there is a Spectrum Toxin Tips International. And the region that I contacted, or I am contacted to talk to, that is basically the first that I would like to mention over here, is Middle East. And in Middle East, there are a lot of people, a lot of Pakistani who, or you could say Indian community, who went from Pakistan to live over there, and they still lack the understanding of cultural differences. So and other therapeutic which are not available to those children, or it is which might be expensive, or they have language barrier, because over there a lot of people are speaking Arabic, and Arabic is a different and difficult language for children, especially for those children who are just learning to speak. So they contacted me to give them different understanding. Sometimes they ask me to give them services as a child, as a family. So that is Middle East and a lot of area over there. Next thing which I would like to talk is one refugees that are children and family. I'm working with them, and over here my concern is more about the problems they are having is just because of their children with learning disabilities, their autistic children, their ADHD, they have intellectual disabilities, or they are being some through some trauma. So my, you could say, the concern or what I am trying to find over here is to have the understanding that are these symptoms which they get or the problems which they are having is because of they were living in the war, they belong to a risk community, or it's because they already have those problems. So over there I'm trying to that find that, and I'm working with them. And the other region that I you could say contacted or work with is Indian community, and one is a picture of a support group that we did, and the other is Instagram live that we used to do, and these are all Indian people. And we have different discussions. Sometimes it's about personality, it's about other things, but the point is uh, uh, no matter wherever to whom I talk to, I usually talk about autism, and that is, you could say that that is my special interest. And no matter whatever, wherever I go, it will come in any way in my discussion. So it is always about that. Now the other thing is that which I talked about the areas Canada, and this is basically a youth organization, and it is in different region of Canada. And we just start talking about trauma of having children who have different special or additional needs, and how a parent, what parents can do about it, or how as a youth they can contribute in that. So this is the and they have a lot of problems because what I learned from those African cultures, that still they are they are they lack a lot of understanding even of, about mental health. So they still have those orthodox belief, and if a person who have those kind of problems, people would isolate them and they will not meet them, and they don't go for treatment, they don't go for therapies, they just go toward rituals which are old rituals for having some kind of struggle. So they lack a lot of understanding over there. Now this is for Somaliland, and basically what I would like to say about this group is I just get in contact with them, and it was basically kind of a kind of a hospital setting, and then they bring other organization, another individual in that. There are some doctors, some nurses, some pharmacists. You could say that there's a basically community, and we just started talking about autism and autism spectrum disorder. Later on, we'll add more topic also, like we'll add ADHD and we'll add other understanding. And what they used to do is, um, uh, they people don't come to hospital when they have some kind of problems, like if they have mental health problems, if they have their children have autism or ADHD, and they don't even understand what to do with those parents, like just left alone, what to do with children. But what they told me is, or what I get understand from their culture is that if a person who have those kind of problems, who are autistic or ADHD mental health problems, who are neurodivergent community, they are isolated in their homes, nobody's talking to them, people are not going toward them, they don't want to talk to them because they think that they are cursed, they don't want to have any kind of socialization with them. And a lot of children, a lot of adults are in chain, or they are inside their rooms and they're not even coming out. So they go to their places, they go to their houses, and they provide them first aid, mental health first aid. So we are working on those projects, and that is, I think, becoming more interesting day by day. And that is from Gambia and related areas. And over there, it is a kind of a youth, and I'm working with them for some time. And we have done different things. For example, we have done different trainings for youth, for organization, for schools, for culture, for different diverse background. And the this picture, the lower picture is about, we just started having discussions more about how to work with children. So these were school children, the teachers who were working with children. I got idea to communicate, got a chance to communicate with children over there too. So those were school teachers, and we were talking about mental health problem over there of children, and their learning disabilities or other problems which they could have. It could be behavior problem, it might be autism, it might be ADHD also. So there was one interesting thing about that group also, because in those areas which I'm talking to, which I'm communicating with, they don't even have access to the internet. So what we do is we used WhatsApp groups, and in WhatsApp group, like if you could see that these are all the slides that I make, and I send them individual slide and I record the message with individual slides. So all of them read, hear those slides, which I talk to them, and then they ask me question later on. So that was a way that we devised somehow to communicate with them, because they don't have access to good internet over there. And I think the least they could do is to have access to WhatsApp, and that's how we conducted over there. So now this is basically having, like, I'm just talking to so many people. Like, for example, I just uh, uh, you could say that I'm day by day, a lot of organizations are contacted me to work with them. And for example, one of them is NIB, that is neurodiversity in business, and like EUCAP also contacted me. And so I'm working with those, and this is also a group, you could say that, where we get a chance to interact with families and children who are not speaking properly, or who cannot communicate, and they have issues in communication. So that was kind of a lyrical cafe, and they were just showing their talent over here. Now this is basically the important aspect of my working, is autistic teenager and autistic transition, which is 18 plus. Over here we are going talking about life skills. We are talking about transition from household to working in the community. So it could be sometimes community services, could be working in church, working in graveyards, working with firearms, like fire department, working with police. So that's how we developed that program, and we are doing that. And this is a basically task based program, and those are practical activities in terms of just doing work, just talking about it. But over here we do practical activities, and we just took their you could say that we are taking their feedback, and they're also helping each other. So it's not just about we working with them, it's also about they working with each other, empowering themselves and empowering each other. So it's basically they're not just building community with us, they're building community within themselves to give them more confidence. And now we like to talk about Instagram lives, and like this one is about the this one, if you can see my cursor, this one was about autism, and where I tried to bust a lot of myths. And uh, this is one of other Instagram live that I do, and this one is about trauma, and that is the regular one that I do, and it is on Tuesday and every Tuesday and Friday. Yes, every Tuesday and Friday. And like my Twitter space, that is on Thursday that I do, and I am just giving the information of the timing whenever I'm going to conduct those. And this one Instagram live is like I'm talking about trauma, problems in schools. It could be bullying, it could be, and I'm also working with you could say that professionals, that how a parent can contact, or how a parent can get help from the professional if something is happening in the school. So that is not just talking to them, but providing a resource and providing a practical understanding and guidance to parents and to the community if something is happening in the school and school is not cooperating, or the child having some kind of trouble, what to do and how to do that. Now this is basically a program that, because there are a lot of problems that this community is having, especially if we talk about neurodiversity, if it's autistic or ADHD, if something's happened and they encounter the police, what the reaction of those children or adult is, they just run away. And there are a lot of incident happened, and it might be still happening right now, that they they are shot by, or they are accused, or they are wrongly accused by the police. So we are working with police over here, and it took us a lot of time to work on those. And basically like I'm working with Sound of Autism, so we just develop that program and give them one step instruction, easy instruction, that is understandable by children and adult maybe, or police officers also. So instead of giving them complex command, just give them simple commands so that get this understanding what to do and how to communicate if they get this idea that the child may be or might be, or the adult might be neurodiverse or autistic or ADHD. So it's basically trying to build a communication and trying to bridge the gap between neurodiverse and neurotypical community, especially if we talk about police forces. So the region that I encounter, it could be US, Europe, Africa, Asia, some part of that would be Australia too, but I just don't get this. Like I am spending my work on daily basis and regular basis. Now over here, I would like to divide the community in three, like autism in white community, autism in black community, autism in brown community. So I just recently get attached with brown community. Like I was working, but I did not find a lot of people who came from brown community, because a lot of people, if they are having, you could say, understanding, a lot of them are living in other countries, like not just in Asian country. They're not living in Pakistan, they're not living in India, but they're living in abroad, and they have this understanding that yes, this is autism, this is some disorder, or disorder, and neurodiversity is a concept. So but if I talk about white community, is we have a lot of, or you could say, a lot of active accounts on social media are coming from the white community, and they're more active over there and doing their, if I have seen, there are a lot of people who are writing books, and um, uh, there are a lot of advocates coming from white community. But if you talk about black community is very afraid to come forward and talk about their neurodiversity, and they are still, you could say, I'm working with a lot of people who belong to black community, and they are still concerned about their safety. They're still having those problems which they might have felt 100 years before, of this culture that we're having right now in US, UK, and other areas. And the reason is that, like, they're still facing discrimination in getting services. They're still facing discrimination in, like, for example, I'm working with a mother, and she told me that her child was used to go to the neighbor, and she requested the neighbor that, can please let me know if my child come, and I will get this idea what he like in your house, and I will get that thing in my house. And later on in that week, that woman called a cop and asked that there is a black child who is invading my property. And that was a lot of problematic situation for that woman. But the point was that the child was black, and from black community, and the woman was from white community. So there are still a lot of gaps that we need to cover. There are still a lot of problems, like if you talk about police problems, if you talk about other problems, black community is still facing a lot of discrimination over there. And if you talk about brown community, if I talk about understanding, the understanding is because people are going and they're visiting other countries. They're visiting US, they're visiting UK, they're visiting those areas if they can afford those things. And that's how, if I am getting any kind of connection, so I'm getting them from people who have somehow access to international community, who have access to global community, so they get this understanding of what is it. If I talk about my own country, if I talk about even maybe adjacent countries, still over here people don't even have this idea that autism is different than intellectual disabilities. If a child get this idea, this diagnosis, then he cannot do anything, and they still consider it as a childhood disorder. Somebody asked me that if it were start working on neurodiversity, I told you that still people think that autism is a childhood disorder. They don't even think beyond that. They don't even have understanding of culture. So in many culture, a lot of things are rewarded. Like girls need to be shy, they cannot talk. If they are not talking that much, then there's a good girl, and boy need to maybe sometimes very aggressive, or sometimes not showing emotions. So there are some things that we can mention over here, that is having the uh, understanding of community wise. And the important thing to over here to talk about is, um, the more we get understanding, the more I'm trying to get to the cultures, the more I'm getting the idea that it's a global thing, and to encounter those things, to encounter the challenges that we are having, is to talk about that, to talk more about autism, to talk more about ADHD, to talk more about neurodiversity, and have this understanding that how to work together, because those children are everywhere. And what I believe is, this is not a new phenomena. People were always there, children were always there. Like, I just give one survey, and from that survey I get this idea that the age which a person got diagnosis was 82 years of age. So a person get diagnosis at the age of 82 that he is autistic. And why he did that? Because uh, there are so many circumstances. Maybe if you get this idea that your child is autistic, or you are autistic as a parent, you cannot have access to a lot of things, or they might take child from you. So there are still people out there. There are still people who are afraid to go to a diagnosis. There are people out there who want to understanding that what is happening around them, but they cannot have the access to facilities, or they're afraid to ask for facilities. So that's all I can say. If you have any question, that I'm happy to answer that question. I'm sure my presentation is not that long. Okay.
Thank you very much. I think this is fascinating work. No, we've been working in Europe for about 7 years to deliberately try to reach out within Europe to find all the autistic organizations and groups that are there. And we are still finding more. And you may be aware that just last year we reached out globally to create a publication that commented on the global recommendations on care and clinical research for autism. But we did not reach any of the countries that you have listed. And this is something that I keep thinking about, like how could we connect the different global networks that already exist to kind of actually begin to cover the whole world. And so question, in these countries that you reach, do you see local support groups or local organizations of autistic adults developing? Or are they all just online for now?
So what I still think is that they are still even try to understand what is autism. So it's not that people, they don't have those problems. They are still over there. There are still autistic community over there, but they are working in some, like they're working as advocate for mental health. So if what I feel that is, they knew that they're facing some kind of problems, but they are not even identified yet. They're not diagnosed yet, but they are working as mental health advocate, or they're working as community to work with those communities, to work with children, to work with adults, maybe to work with families. But they are still don't have those ideas. So there might be, you could say that there are groups over there, and there are adults who might be autistic or ADHD, but they don't even know this yet. So why people work for those? Because if, like, I'm a psychologist, why I'm working with mental health? Because I'm a psychologist, and I didn't get this idea because from day when I started working with autistic children, and I never get this idea that why I connected so easily with them, why I work along with them. If I look toward my therapeutics, and if I look toward my success rate, it is more than 90%, like 95%. I have worked with children who were even non-speaking to I bring them to reading and writing. Like, I'm talking about autistic children, and the reason was all along that I was autistic, and I was able to understand that how to work with them instead of going against the rule, or going against the thing that you have to do that. If child is not ready, how can I push the child to do that? So they are there, they are working somehow in community, somehow for mental health, but they still need to go, and they still need to get this understanding, because there are so many places where they don't even have you could say that they don't have a mental health professional over there. They don't even have a doctors for children. They might have one or two doctors for the whole community. So they need a lot of work to be done. Like, if I look toward my country, we have people, but still we need a lot of understanding. People lack understanding.
What kind of services or research or investment do you think would help countries like this to develop more understanding of autism?
What I'm doing with them is I'm developing communities. I'm developing them to helping them to understand that basically simple start from mental health. What is mental health? And then what is child developmental problem? So if somebody asks me that how to start work, then I will start working on milestone. I will start working with child health. I will start talking about development of a child. He's working or not? What are the behavior problems? So we need to start from very basic. So it's like you need to start from zero over there.
Yeah. And when you run a global support group for autistic adults online, is it always English? That's the shared language.
Yeah, it's in English.
Yeah.
Remember that we have that talk, if we remember last time, that we have to do that on the other languages, and we talk about having some kind of application to talk about that. But one person can open that, and other people have to change that. If somebody asks that translation thing, so I asked them, I requested them to do something about it, and I will request other people also to do something about that. But right now, yes, that is English, and I would like to go on multiple languages also, because we are having diverse population over there, and not everybody can understand English.
Yes, we're kind of beginning to experiment with online forums with machine translation, but then it's just typing, there's still not enough, good quality automatic translation of speech. We have a very long way from that for a variety of languages. But in typed communication, I think we can develop those environments where more people could participate. Just requires them the ability to read and type and
I think somehow the organization that I'm working with, we have Sound of Autism, we have somehow doing that in video you can do that. But I need to ask the people, like I need to request, because if we talk about people, autistic community is very, even not autistic or ADHD, they are very intellectual people. So we need to search, somebody could do that, but we need to push somebody to do that. They will come up with that solution.
Yeah, we have also been discussing the possibility of creating like a global network of autistic translators and interpreters. We think that would bring things forward a bit.
I think that is a easy way to go toward that road, because developing some kind of a tool could take some time, but having the translator who could translate, that will somehow bridge the gap actually. Like you are doing something instead of just waiting for something, some miracle solution. We know that we don't have miracle solution. If I look toward myself, I have very limited resources. I don't have good resources. I don't have good, you could say that, gear to do something. It's not like that. I have very limited resources, but I'm still doing those things, and I'm able to reach people, and I'm getting the result of those efforts that I'm doing also.
Many of the organizations that I work with actually kind of worry about how our groups and organizations being too white. They don't know how to reach minorities in Europe, the Black and brown minorities. So I wonder if some kind of cooperation on that might begin to take us forward.
Yes, if I talk about the reach that I have, I think they're in US actually. In Europe, I need to find out, but I will find out somehow. If I go and dig into that, I will reach out to those people. I know I can, because this is my interest maybe, and the job, you could say that. But we can do that. I think the accessing is not an issue for me. Somehow I will find a link over there, because I'm so interested in cultures. So if start working, things would come toward you. So before that, I used to go to people and ask them to work with me. Now they contact me and they ask me to do something with them. So I'm sure that we will find somehow to work with them, working with Europe, and we will find someone, because there are a lot of people that are working.
Yeah, wonderful. We will start thinking about ways to collaborate and to involve you in some of our work. And I think we have a lot to learn from you. You're muted. Your mic is muted. Yeah, I couldn't hear that your mic was muted. Yeah.
Yes, I think it was. So I would say that I would love to work with your organization in some capacity, and I'm at service. I am always available if it is about autism or neurodiversity. So I don't even look toward time, because my timing is too much different. Even then I work with them if I need to talk to, if I need to work with, and I'm happy to work, because what I feel is there is a lot we need to do, because it's a political statement right now. Everybody is, people are fighting for the things that matters, but that is not a solution. Like autism child, autistic child, or autism child with autism, they are fighting with those things, not fighting with real problems. Like children are having, like for example, if I talk about, I studied in normal school, so a lot of troubles that other people who are not studying in normal school could have gone through those, like could have developed a lot of things, understanding, communication, socialization. So staying in that, people help me understand more about that. So now I not just understand autistic people, I also understand neurotypical people also. I also understand that how they think. So if they would come to me, I get this idea. But the point is that we need to create community instead of creating barriers among those communities. And that is not a solution. We have to sit together, because those children are they're not going to stop. Neurodiversity is not a new phenomenon, it was always there. And more people are coming because we have more understanding right now. So fighting is not going to do anything over here. And I don't even believe on hate. We have to work with each other instead of, being segregation and feeling that we have somebody have taken our rights. Of course, people take other people's rights, but instead of that, we need to put our energies into working, how to work, how to bridge the gap, because we have something real to discuss. We have real problems. We have to understand why a child is not able to communicate, why mutism is over there, why the child is not telling about abuse, why the child is not telling about harassment over there, why the girl is not able to talk about if somebody touched that girl inappropriately, why she cannot stop that person. So these are some real problems, some real struggle that we need to talk about. And we are just fighting over names sometimes. So I think, but the solution is collaboration, and I would love to work in any capacity with your organization, and I'm always at your service.
Yeah, thank you very much for participating in this and I shall edit this for our YouTube channel and pass the word to bring about more awareness of your work as well. I'm sure many people will find it as fascinating as I find it.